Hi, guys. Hi, Lynette. Hi, Michael. Thank you for joining me.
Hello.
Thanks for having me.
Awesome. I'm so excited to have you both here with me today on Michelle's Conversations That Matter. I'm here, with this series, I'm out to cause more understanding, more compassion, more inspiration, and normalize the conversation about mental health. And so I'm so grateful that you both said yes to joining me. It's a very, very important topic today. We're talking about first responder mental health. And you're both experts based on your experiences as first responders. And I'm excited to have this chat with you today. Before we get started, I'd love for you, Michael, to introduce yourself. Tell us who you are, where you live, and what you do.
My name is Michael Bollentin. I am a EMT and I'm a retired police officer. I live in Hightstown, New Jersey.
Thank you. And Sergeant Lynette, can you please introduce yourself, who you are, where you live, and what you do?
My name is Lynette Shaw. I live in North Jersey, Hawthorne, New Jersey, and I've been a police officer for 27 years, a fugitive investigator for 13, and I teach in the police academy, teach about mental health, and I have lived experience.
Awesome. Yeah, we're going to dive right in. This is a topic that's near and dear to my heart. I look at the courageous men and women every day who care for us, but who, as we were saying before we went on the air, who's really caring for them and looking after them. And so, first, I think it's important for people to understand why you care and what your personal stories have been related to this, why you're speaking up about it. So I'd like for you, Michael, to just share with us why this is so important to you, and maybe as it relates to whether it was when you were a police officer or now as an EMT. Love to hear that.
It's kind of a culmination of both my lived experiences as a police officer and as an EMT. I've seen a lot of things. I saw a lot before I became a police officer. I saw a lot more as a police officer, just in kind of different veins. I have lost a number of friends who were in law enforcement because they just allowed things to just stay bottled up, and eventually made that decision to kind of end things, for a lack of a better term. And I think we need to start normalizing the conversation with everybody. The fact that law enforcement particularly are seen as these people who are almost robotic and there's no emotion to it. Given how things have kind of turned out this year and a lot of the events over the last 5-6 years, there's a lot of distrust, a lot of misinformation, and some of that I think is people not understanding what the effect of the job has on people.
Yeah.
And I think conversely, the more that we show officers that if you're having problems or these thoughts that you need to talk to somebody, whether it's a family member, somebody you can confide in, it's a friend, or even a doctor, their mental health and well-being is paramount to their job.
Got it. Yeah. I mean, I know, Lynette, you have a story, you have your own backstory, and you are very passionate about this. So tell us, have people understand sort of why you are so deeply connected as a advocate and an active professional in law enforcement. Why are you so outspoken? Why are you so connected to this?
Well, of course, I have lived experience as well. And as you know, before I became a police officer, I was a fugitive investigator and worked in that vein. I had trauma earlier on in life, and what happened was eventually all of that came up. Diagnosed with PTSD, and working in fugitive investigations, everybody wanted to, work with me. I was taking risks, jumping from roof to roof in Manhattan, doing undercover stuff in Manhattan on the first wave of the epidemic of heroin epidemic.
Mm-hmm.
And so, everybody thought I was so cool, and again wanted to work with me, right? And what they didn't know, they didn't see me at all. What they didn't know is I was absolutely suicidal without a doubt. And many times they don't see these things because they look at what you're doing and how courageous you appear to be. But those are the people who really are struggling. The ones that look like they're so strong. They seem to be, I don't know. Sometimes you see in the news, when first responders, you see the tragedies happening, that what people say most is that, oh, he was on the, Little League team. He coached the Little League team, right? And he was the best guy and always happy and always uplifting everyone else. And see, that I think is a real, that's something to really look at, because when you see somebody who's so strong, they can put that out there, but there's something else going on underneath.
Right. Why do you think, and this is for either one of you, why is it that first responders just typically do not reach out for support?
I think in my experience, it's been kind of, they're so focused on taking care of other people, they don't have the time to look at themselves in the mirror and see what other people might see or might question. I kind of think that that's really where it comes from, at least from the EMS aspect of it. I think with law enforcement, comes from a different avenue of, they don't want to appear to be weak in any way, shape, or form.
Yeah, I agree, Mike. We're always looked at as the people who are coming to rescue, right? It's not only on the job, but it's also at home, right? We take care of things no matter what it is. We're taking
Right.
care of things. And that expectation from other people is huge. I mean, you don't want to let people down. And then when you're out there working and people call on you for, to help them, because nobody calls police when, the wife or husband, has cooked dinner and, and the kids are acting right and the grades are good. Nobody's saying, "Hey, officer, come on over."
Right.
We're having a good day. Well, people call you when it's the worst time in their lives, and for things that are tragic and all kinds of things they call the police for, right? And so that we have to be the ones who are standing up on behalf of those people, right? And we have to be the ones that are strong when they're weak. And oftentimes our mental health or what we feel about it or how we get involved with it, that's like totally overlooked. And these things affect us. I mean, imagine 25 years, 25, 30 years of this and responding to calls where you see tragedy. It's not good on your mental health at all, especially if you're not doing something on a regular basis to mitigate those things that are happening.
Right. To kind of go off of what you just said, I've always seen that 90% of law enforcement is the interactions are based on something in the realm of negative. So I always took every opportunity that I had to try and leave a positive impact on the people I was dealing with, on every encounter that I had with somebody, whether it was an arrest, a traffic stop, a crossing guard post, any interaction with people, I was trying to leave a positive thought about law enforcement with them. One, because it made me feel good, which it's always a bonus. But because of what you just said, it's almost everything that we deal with it starts off on that negative foot. So I think it's our responsibility to mitigate and kind of level things off as best we can as the circumstance dictates.
Mike, what do you think? What do you think that police chiefs need to do? What do you think that there is? Where's the opportunity? Where has this gone wrong? How do we sort of make changes for first responders? What are you thinking?
It's hard to say if anything's really gone wrong. It's just how there's so much that chiefs have to deal with.
Yeah.
And in my experience, the best chiefs are the ones that They know how to delegate. They know how to lead by delegation. They also know how to lead by action. I think if we saw more chiefs speaking about their mental health, either as it is or past experiences that weren't the greatest of their times, you're going to start to see that kind of build the culture that, well, if the chief can talk about it, I can talk about it. So I'm not sure if there's anything that triggers on a bad path outside of the mentality that cops can't show weakness. The more we push that aside and get that out of the way, I think we can get on this path of, or maybe course correct a little bit, to having this open discussion, and for more officers to see that it's not a bad thing to say that you're having a bad day. It's not a bad thing to say that you're just feeling like crap, for lack of a better term. It's going to foster that thought process a little more, and hopefully mitigate a lot of the things where cops don't say anything and they bottle it up and they end up taking their own lives.
Yeah, like leading by example, right? Like having a police chief or a leader go first, or acknowledge their own well-being. I mean, I've had experiences where I've had police chiefs say to me, all my people are fine. All my people are fine. I know they're fine. They took a test when they first became a police officer. They're fine. But what scares me is that they were fine at one point in time. And our mental health is an ongoing process. Like, we deal with life, and you all deal with life in a very different way than we do. You see things we can't even imagine. So how do we wake those? Those are the ones I'm concerned about, the ones that think that their officers are fine.
Well, like you said, the last time they might have had a mental health checkup was, or any type of assessment, not even necessarily a checkup, but just an assessment, was before they got on the job, before they were hired. For some people, that could be 2, that could be 5, it could be 20 years. A lot can happen in those time frames. They can really change somebody's personality and their mental health. So I think maybe having regular wellness checks. I mean, they have physicals. My department, twice a year, I believe it was, we had a voluntary thing where if you could pass the physical exam, you got a couple extra bucks in your check. If we can do that and start driving the idea that not just the physical well-being, but the mental well-being as well, the body and the mind work quite well together. And when you have 2 good paths and things are in the right place, you're going to have more effective and better officers.
Lynette, do you have anything to add to that?
Yeah, I think, again, just like Mike said, we get tested and have a psychological in the beginning of our careers. I think there should be an assessment every couple of years. I'll give you a good example. I trained one of the crews in North Jersey, and he gets out of the academy the first day and goes on duty. First call he gets is a murder-suicide. He walks in, there's a husband that shot his wife, and there's blood all over the place, and then he shoots himself, right? So now that's his first day on the job, right? What do you think the rest of his career? There's going to be something in that career, and that was his first day. Imagine what that is. And remember, these kids are like 21, 23 years old, right? The brain doesn't even mature until 26. So that is huge for some young mind like that. And so any young person to walk in on something like that, and that's just the first day, right? So I will give you another example where I got a call of somebody, a welfare check in the dormitories, and I get to the kid's room and he's dead. And it's a kid that I knew, 23-year-old athlete. And I went in and I had to process the scene and take 200 pictures, right? And the smell, everything was releasing and whatnot. But that wasn't what really got me. What got me was the students inadvertently called the mother and sister before we were able to notify. And so I had the mother and sister outside of the building. I'm on the 6th floor, and they're screaming, "Where's my son? Where's my brother? I need to see him." And I could hear that from the 6th floor. And I got somebody to get them in and bring them in. And I had to notify them that their son and brother was gone. Now that's one instance. And I went from that call, right? I went from that call to another to assist another department in a heroin overdose. And they're doing CPR, right? This is in one day. They're doing CPR. And so we go back and forth trying to, bring the guy back. All of us know that he's not coming back. He's gone. The wife's in the other room crying, and you're looking up while you're doing CPR, and you see a picture of a family with a little girl in it. And okay, so now for nights, I could smell and hear those the mother and sister screaming. Where's my and that is tough. That's one day.
Yeah.
That's one day. Look at a career of 30 years or 25 years. And people, human beings are not supposed to endure that kind of emotional distress.
Yeah.
And here's the thing, this conversation is not normalized, right? So we have to normalize this, especially for first responders, because who takes care of us if we don't put our mask on? I love that adage right from the plane. You put your mask on first and then help someone else. That is so true with law enforcement, right? Law enforcement and any first responder, you cannot respond and serve people to the best of your ability unless you're whole, unless you're able to deal with your stuff. And we have to be courageous enough. Look, we're heroes. I believe that with everything in me, just that we chose to be first responders and we want to help our communities. We are absolute heroes. But why should we be sick or get sick from the amazing job that we do, right? We shouldn't. We have to mitigate that piece by piece by piece. I tell the recruits, the best thing you can do before you become a police officer is get a therapist. Because guess what? I don't care who it is. You're going to need to talk to somebody. You can't bottle it up. You're going to need to talk to somebody, whether it's finances. See, because life doesn't stop. You're still going to have financial problems, maybe, right? You're still going to have relationship problems. There's divorce. There's death and grief, family members dying. So that's secondary, right? To doing your job, and you see all of this all the time, right? You still have a life, and these things are going to happen in life. And bringing both those things together, your personal life and what happens there, and then your professional life, what you have to do to help your community, that can be a recipe for something really bad if we don't get the help that we need. And if we are not courageous enough to acknowledge that, hey, wait a minute, I'm really not feeling well. This is not good. I'm dreaming about these things. I gotta talk to somebody about this, right?
Right. Really, really important. I love your passion. It's so important. Michael, you're an active EMT right now, right?
Yes.
During this pandemic, and I can only imagine. What you've been seeing. How do you take care of yourself? How do you keep yourself together after months of a pandemic and people being sick?
I think my processes. Well, that's one thing I think people don't understand. Everybody has their own process. And what I do might be different for what you guys do. For me, I find my ways to compartmentalize the things I've seen. I mean, I had a lady 2-3 weeks ago. She was 95 years old. She was typically in almost a catatonic state as it was. We got called because the doctor wanted her transferred from the facility she was in to the hospital because her oxygen saturation had dropped down. And my partner got in there and we're looking at her, and she barely looked alive as it was. I mean, I think her pulse rate was somewhere near 30. She was breathing maybe 4 times a minute. And we looked at the nurse and we're like, are you sure she doesn't have a DNR? I mean, given her age, her health typically, and the family's, she's like, no, the family wants, she codes, she needs full resuscitation. And it was kind of frustrating. And what I kind of see is a little bit of selfishness on the family's part. You have somebody that's lived this long and they're not in the best of health, kind of let, as callous as it may sound, it just kind of let things take its course, but that wasn't the case.
Mm-hmm.
And as we get her into the ambulance, the paramedics are there, and the medic looked at me and goes, I told him what was going on, what we assessed, and he looked at me and goes, great, I get to torture a 95-year-old lady because the family doesn't want to look at reality. So I take things like that, and I take the things that I've seen, and I've always been able to deal with it and kind of let it go and separate myself. I don't think that I've changed anything over the last year.
Mm-hmm.
It's really just the cycle that I've kind of got myself into, that when the call's done, I look back on it. As long as I know that I did everything that I could have and should have,
Mm-hmm.
I pack it up, put it in a box, and that's how I deal with it. I do know people who have had some really horrific experiences. I mean, I too, in my EMS career, have dealt with some pretty horrific things. I was fortunate enough that after one of the specific incidences that February 25 years, we had a crisis intervention team come in to debrief us. Mercer County was really good with EMS, that after any calls that were absolutely could be devastating for the mindset of somebody,
Mm-hmm.
whether it was dealing with the traumatic, dealing with the death of a child or something along those lines, they would bring in the crisis response team, specifically of EMS providers that were also trained with mental health, that it helped, do just that, debrief us and
Mm-hmm.
kind of get us back on our page. The incident that I was just referring to was my girlfriend at the time was on her way to see me. My last words to her were, don't walk, I'll come pick you up if you need a ride. I was delivering pizza for a place, and I heard somebody come in after I was in the bathroom, and I immediately heard the voice as her best friend, and she was screaming that she was in the road. There was a police officer actually in the pizzeria eating his dinner at the time, and I blew past him out the door and went to look for her. She ultimately died effectively on scene in my hands. I was the first one there. I initiated CPR on her. Her family was part of my EMS family, so it was pretty traumatic, just in the fact that she was so young. I mean, she was only 16 at the time. But then her connection to the people within my squad. So that was one of the big incidents where I think Pegasus Group helped me personally.
Mm-hmm.
But there's a number of things that are close to that I've dealt with, and I think I've always had a way to put it aside after evaluating. I address it at the moment, I guess,
Mm-hmm.
and didn't let it bottle up and didn't let it fester. I think because I addressed it and kind of put it in its box and set it on the shelf, so to speak, that's how I've always dealt with everything negative or bad and horrific that I've seen.
Wow, thank you for sharing that. That's got to be hard, and so sorry for your loss.
Thank you.
Oof. Lynette, how do you deal with it? I know you see some stuff. I mean, you just rattled off 2 examples. I mean, how do you deal with it?
Yeah. I mean, I've seen a lot, and I've experienced a lot. And so, the mind is a amazing thing, right? You can automatically it presses things down, but what I realized is I had a lot of repressed stuff. I never put it in those boxes and put it on the side. although I thought I could compartmentalize things and I thought I was, what I realized after a while is that all of that stuff just started to seep up. And so I sought help with therapy. And therapy absolutely saved my life. Therapy is not for everyone, but I would ask anyone to absolutely try it, because even just getting, some of the every stuff off of your, up and out, it absolutely helps. And the other thing is I find things that I like to color. I have adult coloring books. I like to vacation. The beach is really, calming and peaceful for me. And so I travel a lot. And, I take care of myself. I go get massages. I get my nails done. All of those things that, I try to pamper myself and take care of myself that way. But again, therapy really saved my life. I've been in therapy for over 20 years, and I still see my therapist on Zoom, or no, not Zoom. It's something else, WhatsApp or whatever. But I still see my therapist every Wednesday, and sometimes it's once a week, and sometimes, if I'm dealing with a couple of things that I really need to talk that out, I'll say, hey, do you have another appointment, please? But I will tell you that has helped me so much to just like get everything out, so I don't carry anything.
Yeah.
I carry nothing. And I'm diagnosed with PTSD, but I don't have anxiety or any of that stuff anymore, because I think it's because of the therapy, to be honest with you, and also learning how to take care of myself first, putting that mask on my face first, and then helping others. Sometimes it can be difficult, especially with those who are, helpers, right? We always tend to put everything else first, everybody else first before us. Well, I changed that. I turned it around, because I need to live, right? I need to be able to do what I love, and that's serving others. And I can't do the best job that I can if I'm not well myself. And so I intentionally take care of myself. And that is something that I would give to first responders. If you could turn that around, because it's not natural for us, givers. We're used to giving, right? But we need to be able to receive, even if it's the love that we give ourselves. And sometimes we don't even let other people help us, right? Because, hey, we're the ones that are supposed to help, right? But I've learned now to allow people, to give me that gift of, of caring, or they can do this for me, or what, and I've learned to be open to that. And it's real hard for first responders to receive.
Agreed.
Yeah.
To kind of touch on two of the things that you brought up, when I was teaching the academy, I always made sure to tell the recruits, find a passion outside of law enforcement, has nothing to do with law enforcement, as your escape from law enforcement. Whether it's, like you said, coloring, whether it's vacationing, jujitsu, anything that doesn't necessarily or specifically deal with law enforcement, that it gives you an escape from everything that you can kind of dive into and makes you feel good. And we also, when I teach EMS, we always teach the first thing is scene safety. You don't go in, your safety is first, then your partner, and then the victim. But that's always overlooked when we're talking about mental health. It's always in the actual physical of addressing the emergency at hand, but some people don't see the emergency at hand is in their head.
Absolutely.
And when I was dealing and processing with kind of not being able to be a cop anymore, that hit me really, really hard. And my wife noticed a few things with me, and my demeanor changed. She almost forced me to go see somebody and talk to somebody. And I got a therapist, and she helped me process a lot of that and gave me some very sound advice that my wife saw the changes in me that she was hoping that she would see because I sought that help. So from my own personal experience, it doesn't hurt to find somebody that you can relate to and talk to, just to have that out. It's just one extra outlet. It's a little release valve that helps kind of release that pressure so it doesn't build up and turn horrifically negative.
Amazing. I love that you shared that because, I guess if we could leave people, first responders, people that love first responders with some words of wisdom. I mean, I think that your examples of how you navigate your wellness and how you own your wellness and what's worked for you is really important. Any words of advice that you have for, and we talked a little bit about this before, but I really change has to happen at a cultural level. And I feel like, the cultures in some of these institutions or, police offices, I guess, is that the fear, people have fear of admitting. I mean, what is it that needs to happen at each of these locations, police officers, for police chiefs? I mean, yeah.
Well, I think that we just really need to normalize the conversation. It is nothing wrong with you having issues with regard to what you've seen. The average person wouldn't be able to handle half of the things that we see, right? So how could you expect? We're normal, right? That uniform doesn't make us like Superman or Superwoman. It really doesn't, right? And we have to have that conversation normalized, and from the top down, they need to let their people know that it's okay. You can come to us. And see, what police officers are most afraid of is losing their gun,
right?
And because that's their livelihood, right? So they're afraid to talk because I'm going to lose my job. Right. But what I always say is, you know what? You're going to lose yourself. That gun doesn't matter. The job doesn't matter as much as you do, right? And there's so many things that you could do, right? Police officers can go get help without notifying the agency, and they can get help. They could take family leave and go if they need to go to a rehab or something, or just to get themselves together. And nobody has to know that. They can call cop to cop, or they can use their EAP, employee assistance program at the job if they trust it. But most police officers don't. So the best, thing to take away from this is that police chiefs from the top down need to make sure that their people know that it's okay to talk about this. And we will support and help you navigate this. Because if the person 9 times out of 10 is a police chief, he's been in the ranks and he knows what this feels like. And to deny that they've never had, to deny that they've ever had a mental health problem, whether it be depression, isolating themselves from their families because their families couldn't possibly understand what they just saw. So I can't talk to them about it, right? So whether it's isolation, anxiety, depression, whatever it is, they've experienced it. They need to be able to support their people with speaking out and saying, look, this is okay. This is okay. And I think if we would get it from the top, that a lot of things would change, and that support was there, genuine support. That genuine support was there. I think that police officers would be more, apt to coming out and saying, okay, look, I need some days off. I really need to navigate this. Right?
Yeah.
Police should say, hey, I think you need some days off. We're going to support you with everything, but look, you need to go rest, talk to somebody, and see how you can, help yourself.
Right.
I think you nailed it. And it is a cultural shift that needs to take place. It's the mentality that, like you pointed out, they're afraid to lose their gun because for some reason that's their life. They see that as their livelihood. it needs to be more normalized that you can go get help and you won't have your gun taken away. And if you do it, as long as you get things addressed, it won't be permanent. It's not that big of a deal. You can't, like, there is life outside of law enforcement. That's me. I never expected to retire early as I had to. And the more we normalize talking about things and really notating what mental health is and what it isn't per se, there are people that I think struggle with things that don't realize it's a mental health issue. They just think it's whatever. They don't make that correlation. So I think the more that we normalize the conversation, the more that we speak out about things and speak about our problems and our experiences as a whole, they're going to say, oh, well, I did feel that. I didn't realize that was what it was.
Mm-hmm.
I mean, law enforcement traditionally has a high prevalence of divorce and alcoholism and suicide. And I think the more that we talk about these things, those rates will go down, because it's not going to be as balled in as much. You're going to have happier, healthier cops out there doing the job, which may kind of set off other things in a positive direction as well.
Yeah, and that leads me to my next point, which I want to leave our audience with some hope here, because I'm excited, Lynette, about the work that you do with new recruits, right? Like, mental health is part of the entry into this field now. And I think that's a beautiful thing, because with new generations coming in and having a healthier relationship to mental health, it could actually help shift the cultures within these agencies. What are your thoughts on that, Lynette?
Yeah, I think that's going to happen, just because of the response of the recruits. After the class, they're saying, how can I, will I not get promoted if I get a therapist? They're asking really good questions, which makes me know that they're considering doing what I suggested.
Right.
And that's huge for young people to say, wait a minute, okay, so if I get a therapist, what's the department going to say? See, they already have an idea of what it is right now, right? But they have to shift this, right? And I had also recruits that said, hey, look, I was traumatized and I wasn't doing too well and, whatnot. What can I do? And look, I think that's so positive that they're open to it. And the reason they're open to it is because I lead with my own story. I tell them I'm going to undress everything. I'm going to show you, I don't care what you think. I don't care. I'm going to undress. I'm going to show you what I've been through. And when I do that, it's almost like a light switch goes on, and it gives them the courage to speak and to open up. And if she can, tell us about that, if she survived all of these things, then I need to listen. I need to listen, and there's hope for me, because again, they're going to be on a job for 30 years now with the new contracts. They need to, and that's what I said, as you need to take care of yourself first. In the police academy, the focus is officer safety, right? And they show us how to take people down, how to avoid people shooting you, and all of those things, right? How to fight, all of this
situational awareness.
But we never learn, right? And that's why I'm so grateful that they're allowing me in there, right? We never learn how to take care of ourselves mentally and how to handle the job, right? And so, at least in Passaic County, we are doing that. We are teaching recruits how to handle your mental health, because when you're aware of your own emotions and what's going on inside of you, right? A lot of that stuff affects the way that you police. Yeah. Right? So, but if you're aware of what's going on inside of you and you take care of you first, you're going to be so much of a better police officer, a better public servant to others, because you're aware of what your issues are, and not to project that out into the people that you're serving.
Powerful.
Agreed.
Yeah. Powerful. So, Michael, what are your final words of wisdom for anyone in the first responder space out there that you would want them to know, new recruit or, person who's been doing it for a while?
For the new recruits, as Lynette said, it's being comfortable within your own skin, being able to recognize when you're having problems and addressing it immediately. Don't let it fester. And for the older officers and people in EMS and things like that, the older first responders, make a checklist. Make sure you're prioritizing yourself and your mental health over everything else. Make sure that you're dealing with things properly, and if you're not, get the help you need, and be the advocate by your own experience to show that it's okay to do that.
Anything else? Wonderfully said. Anything else to add, Lynette?
Well, I just, it's a courageous thing. It's not weak. It's a courageous thing to open up and be able to say, wait, I'm not okay. And that is absolutely okay, because you give others the courage to say, I'm not okay, right? Just don't be afraid to come forward, and don't be afraid to get help, because you're the most important. You have a family, you have children that you need to set the example for. And we don't ever want to let people down, but we need not let ourselves down. We are absolute heroes. We are amazing public servants that just want to serve, but we need to serve ourselves first, prioritize our own mental health. That is first. You can't do anything without your mental health.
Thank you.
Great.
Wonderful. You guys are great. I'm so grateful that you came on. Thank you for giving me some of your time today in the middle of a snowstorm to shed some light on this important topic and hopefully inspire people. So thank you.
Thank you for having me on.
Thank you for having me.
Thank you, guys. Enjoy the rest of your day. Stay safe out there.
You as well.
Thank you, Michelle.
Bye-bye.
Bye-bye.